Good morning, and welcome to Vision Health Conference, October 2024. My name is Michael Balarjan. I'm the Senior Manager, Eye Care Initiatives for the Canadian Council of the Blind. If everyone would look at the screens right now, the QR codes are up there. One of the codes will give you today's program, and the other code will download the report. So both codes are active, and you can, for those people watching via Zoom, you can download today's program and also the report. In the spirit of reconciliation, those gathered here with us recognize that our work here today takes place on the unceded, traditional, and current territories of the Algonquin and Anishinaabe nations. The Canadian Council of the Blind honors all First Nations, Inuit, Métis peoples. We acknowledge their valuable past and present contributions to this land and their culture and presence that have nurtured and continue to nurture. We are committed to a renewed nation-to-nation relationship with Indigenous peoples across the whole of Canada, Turtle Island, based on recognition of rights, respect, cooperation, and partnership. Thank you. Megwich. I would like now to call up the National President of the Canadian Council of the Blind, Mr. Jim Tokus, and the President and the CEO of Fighting Blindness Canada, Jennifer Jones.
Ladies and gentlemen, it gives me great honor on behalf of the Canadian Council of the Blind, its board and staff, partners from Fighting Blindness Canada, to welcome everyone to today's event. Please sit back and enjoy the proceedings, and we are so honored to be in your company. Thank you.
Hey, Jim. All right. Good morning, everyone, and thank you, Jim. I'm Jennifer Jones, the President and CEO of Fighting Blindness Canada. For those of you who are just learning about this organization, and Doris is one of them, we were sitting with the lovely Doris at the back table. We are of Canada's largest charitable funder of vision research. We also provide expert information, education, community connection, and advocacy. For those that this is helpful for, I'm 5'6", blonde hair past my shoulders. It's a little humid today, you can tell by the hair. I'm wearing a white blouse, dark jeans, and my favorite comfy sneakers. I'm thrilled on behalf of Fighting Blindness Canada and the Canada Council of the Blind to launch our joint 2023 report card on vision health in Canada. I also want to thank CCB for hosting this launch party in a location that is both accessible and beautiful, and shares a lot of the values I would say that we share too. So it's a wonderful space to be, bring us together. Both our organizations are celebrating milestone birthdays this year. For us at Fighting Blindness Canada, that's 50 years. And for Canada Council for the Blind, that's 80 years. Combined, that's over a century of us serving the vision loss community. Each of our organizations, along with the other vision health stakeholders, many of you in the room, play a unique but important role in this ecosystem, especially as we come together for projects like today's report card and the National Eye Care Strategy. Together, we know that we're stronger, and it's wonderful to be part of today as an example of that. This has been an exciting few weeks for the vision health ecosystem as we move even closer to the approval of Bill C-284. That will establish a national eye care strategy in 2024. When I joined Fighting Blindness Canada about a year and a bit ago, I learned that this national eye care strategy was underway, and I gotta be honest, as a Canadian, I was gobsmacked that was still not present in our Canadian ecosystem. Think about what dentists have had and we all grew up in, realizing we're a little behind, we've got some catching up to do, so it's really exciting to be able to be part of that journey. Last week, in particular, Fighting Blindness Canada and Canada Council of the Blind were in Ottawa to act as witnesses for a Senate committee hearing about the bill. And today, the Canadian Association of Optometrists and the Canadian Ophthalmological Society are presenting in Ottawa for the same piece of legislation. So while we're not at the finish line yet, we are definitely in the sprint mode. And I think where we are today speaks to the commitment of so many people and organizations. The strategy is long overdue, and the need for it will be apparent as we talk more about the results of the report card and how what the state of Canada's eye health is right now. As we look to the future, we have hope because of the advances in treatment and technology that are having real impacts on Canadians living with vision loss, and because of the dedication and support of so many of you who are driving the change. And that is my perfect segue to acknowledge the support of so many of you in this room, our vision partners that made this report card possible and are with us today. That is AbbVie, Apellis, Astellas, Bayer, Biogen, Johnson&Johnson, Macumira, Roche, and Specsavers. A genuine, heartfelt thank you from all of us to all of you for making today possible. And I hand it back to Michael.
I would like now to welcome to the stage the first Vice President of the Canadian Council of the Blind, Leslie Yee, who's going to speak about Remembrance Day. As pointed out, this is the 80th anniversary of the Canadian Council of the Blind, and 80 years ago, 10 veterans blinded by World War II got together and started the CCB. So Remembrance Day is an important point for us. Leslie?
Esteemed guests, colleagues, and friends, it is an honor to stand before you today, especially as we gather during the pivotal time at the Canadian Council of the Blind's Conference on Vision Health in Canada. As we reflect on the important work we do to enhance the lives of those with vision loss, we are reminded that our ability to work in service of others is a privilege afforded to us by those who came before, those who sacrificed for the freedoms and safety we enjoy today. Today we take a moment to recognize Remembrance Day, a day that holds deep meaning for Canadians from coast to coast. We honor the men and women who have served in our armed forces, those who fought and continue to fight to protect the values we hold dear: peace, democracy, and human dignity. Their courage and selflessness laid the foundation for the opportunities and freedoms we sometimes take for granted. It is because of them that we can come together in spaces like this to work towards building a more inclusive and equitable society. As we focus on vision health today, we are also reminded of the sacrifices made by veterans, many of whom returned from conflict with injuries that altered the course of their lives, some losing their sight, others facing immense physical and emotional challenges. The brave individuals have long been at the heart of the fight for better rehabilitation, accessible health care, and a compassionate society. Collectively, our organizations have stood by their side, ensuring that no one who experiences vision loss is left without the support they need to live the life that they choose with dignity and independence. Today, as we honor our veterans, we must also renew our commitment to serving them in meaningful ways, whether through the development of cutting-edge vision health services, improved access to care, or enhanced rehabilitation programs. We have a responsibility to ensure that their sacrifices are never forgotten and that their quality of life is always a priority. In the spirit of Remembrance Day, let us also reflect on the values that unite us: resilience, compassion, and a deep respect for one another. These are the values that drive our work in the vision health community and inspire us to push boundaries, find solutions, and build partnerships that make a real difference in the lives of Canadians. As we observe this solemn occasion, I encourage each of us to take a moment of silence to remember those who have fallen, to honor those who serve, and to reflect on the impact of their bravery. Let us never forget. Thank you.
This is a very special task I have. I would like to introduce Dr. Alison Scott, Vice President, Canadian Association of Optometrists. And I would like to call her up to the stage, and Shelley Ann Morris, if you would come with her. I think we just do it right there. Yeah, Allison.
Thank you so much. Okay, so today we gather to discuss the challenges Canadians still face with their eye health in a post-pandemic era, while still looking for new developments in prevention and treatment and support for the visually impaired community in order to ensure better outcomes for the whole population. And there still is hope. As we are all involved in this journey, today is also a time to celebrate individual initiatives. The Canadian Association of Optometrists has a tradition of recognizing significant contributions to public eye health and vision care with the Vision Champion Award. This year, we are very pleased to celebrate one person who advocates tirelessly every day to improve accessibility for the blind and visually impaired individuals, and hence improve their physical, mental, and social well-being. From conquering the CN Tower's 1,776 steps, I'm just tired thinking about it, co-hosting a pioneering radio show, to championing accessible public transit and fostering inclusive sports, and volunteering in music festivals in Ottawa when she finds the time as well, she never lets obstacles stand in her way. As a visually impaired athlete, she is deeply committed to promoting inclusivity and accessibility. From tackling physical challenges to competing in running events and triathlons with sighted guides, she is proof that with the right support and mindset, there is no limits to what people with visual impairments can do. A longtime participant in the CCB's Get Together with Technology, or the GTT program, she is a strong proponent for the role of technology in empowering people with disabilities. She co-founded the CKCU FM radio show, Welcome to My World, a show by, for, and about people with disabilities, alongside Kim Kilpatrick, founder of the GTT program, and they ran it for 7 years. Her commitment as an athlete, an advocate, and a dedicated employee of the Canadian Council of the Blind, or CCB, has positively impacted countless lives across Canada. She is also a key member of the Alliance for Equality of Blind Canadians, where she successfully advocated to reverse a city decision on push-button doors for the LRT system. Another notable example of her work is Active Living Alliance for Canadians with Disability, where she played a pivotal role in enabling blind and visually impaired people to engage in physical activities and sports. It is my great pleasure to introduce to you our 2024 CAO Vision Champion Award recipient. Please welcome Shelley Ann Morris. Thank you. So, dear Shelley Ann, we are very honored to present you with this award. Thank you for sharing your personal experiences by setting an example of resilience and perseverance. Your impactful work and efforts in breaking down barriers, broadening perceptions, and opening new opportunities for people who live with visual impairments are a true inspiration for us all. You truly embody what it means to be a vision champion, and I'll hand you the mic.
Thank you so much. I'm really very honored and very surprised when I was going to get this award. This completely took me by surprise. I wasn't expecting it at all. First, I'd like to say how lucky I was as I was growing up as somebody with low vision. I always had a lot of good people in my corner. I had family, friends, teachers, a community, and blind and low vision peers who really helped me build that foundation. And in my life, I have seen so many good, positive changes, so many I can't even mention them all. We'd be here all day. But I will say technology has certainly opened up a lot of doors for a lot of people. And as many of you know, CCB has a wonderful program called the Get Together with Technology program, in which blind and low vision people teach other blind and low vision people how to use technology to enable them to lead very independent and fulfilling lives. Also, what amazes me today, just being in this room and having so many different organizations being brought together, what's amazing about that is that because there's so many of us working toward many of the same goals, we have achieved so much for those living with vision loss in Canada and beyond. I can't thank everybody enough, everyone who was involved in choosing me to receive this award. I don't want to name names because, again, I'm going to forget someone and we'll be here all day. So I just want to say thank you to everybody who helped me along the way. And I also want to wish everybody continued success in all their endeavors, because we've done a lot of work. We've still got some work to do, but we are doing just fine. So thank you so much.
Congratulations, Shelley. This is where I was supposed to give somewhat of an update on Bill 284, but Jennifer stole my thunder. One thing to add, Jennifer Uzovic was supposed to be here today, and she got called to testify and give witness before the Senate committee today. So it's the Vision Loss Rehab Canada, the CAO and the COS are all there this afternoon. To add, I had a conversation with Judy Scrow, and this is what they're hoping to happen. At the end of today, the committee work will be done. Tomorrow, they will go through the Senate committee, and the Senate will go through the bill line for line, and hopefully about a week and a half, 2 weeks from now, the bill will receive royal assent. To give you an idea of what happened at the hearing, I have arranged that we can see the witness from Larissa Monez from FBC, from Jennifer, my brief introduction, and Ian White's witness. Now, after that, Jennifer Jones said that he was a rock star. And Ian took it to heart, because before he got here today, he told me that he needed certain types of Pepsi-Cola, certain sandwiches, and grapes put in a green room that doesn't exist. So congratulations, rock star. And without further ado, I would ask Mohammed if you could run the clip, please.
Madam Chair and all the senators today. Dr. Larissa Monez and I work very closely at Fighting Blindness Canada on behalf of the entire community of vision loss that we support. It's a real delight to be here today. It's a monumental time for all of us. And together with our colleagues, we work very collaboratively to support the community of vision loss individuals who have real complex and multifaceted needs. In order for us to be able to serve them as best as possible, there has to be a lot of transparency and collaboration across the organizations. Fighting Blindness Canada has served this community for over 50 years. In that time, we have become the largest charitable funder of vision research in Canada. We were founded by parents whose children were born with an eye disease that would lead to blindness, and at that time, there was no hope for treatment. So since 1974, that has been our purpose. It has been to invest in world-class research in the pursuit of treatments and cures for people facing the loss of vision due to a blinding eye disease. And why is that so important? In Canada, there are 8 million individuals who are living with an eye disease that could lead to blindness. Of those, at least 1.2 million are actually already on the journey of losing their eyesight. Some of those may be for eye diseases that you're more familiar with, like age-related macular degeneration or glaucoma, but there's also other very more niche or rare eye diseases like retinitis pigmentosa and uveitis. There's a significant economic impact. I know the Honorable Judy Sgro was speaking to this yesterday, of almost $33 billion due to the financial quality of life and reliance on the healthcare system. These figures, though, represent real lives. We're talking about individuals who are losing their driver's license and becoming isolated at home because of age-related macular degeneration. One of our recent board members who just joined had to retire as the head of actuarial services at PricewaterhouseCoopers because his retinitis pigmentosa was no longer allowing him to pursue his career. So that's one example. Another is parents who are having children born with an eye disease where they will lose their sight in their teens and their early adulthood, and parents are questioning whether or not their child would be able to live independently and pursue their dreams. I would say very much the place that my grandparents were in when their younger son, my mom's brother, was born with retinitis pigmentosa, and he did become legally blind in his 20s. But like a lot of diseases, when there's an application of resources, care, passion, and time, these are preventable. 75% of a lot of these cases are preventable, and that's the reason that we do the work we do. Now, vision loss has days that spike. World Sight Day, for example, was October 10th, and that's a moment for all of us to rally behind. But in truth, what we really need is consistent application of care to national eye care. And that's the reason that this strategy is so important to us. We want to make sure that there's a comprehensive and consistent focus on the full spectrum of eye health care that we're all going to speak to in turn. Better education and awareness, better access to diagnosis and treatments, and more investment in research that will drive better outcomes and an improved quality of life.
I'm just going to speak briefly a little bit about research, because that really is Fighting Blindness Canada's focus, as Jennifer has mentioned. And so for the past 50 years, we've invested over $45 million in research and education, and all of that has been funded by donors. So we know that the Canadian community is really passionate about research and understands the value that research has in improving treatments, improving outcomes. But the capacity of donors really does not meet the needs of the vision research community. And so that's where we're looking for the National Eye Care Strategy as part of the suite of things that it will bring forward: greater awareness, better prevention, better treatment access and rehabilitation, also dedicated funding for vision research. In Canada, we don't have dedicated funding for vision research, and I think that's an area that we're really falling behind in. So some of the areas that research can improve outcomes, because it really is the foundation of improving treatments. Just two examples. About 20 years ago, a new treatment of medicines was approved that has reduced the rate of blindness from wet age-related macular degeneration by 50%. And then in 2020, very recently, the first gene replacement therapy for a disease, for any disease actually, was approved in Canada, and that was for a rare inherited eye disease. And we've talked to community members who've received the treatment who all of a sudden have hope that they won't be going blind, who can see the stars for the first time, or parents who have talked about taking their children to school and seeing that their children can actually recognize their friends' faces for the first time when they couldn't before. So that's really what we're looking for. We're looking for more opportunities of hope, more opportunities for wins for our community. And in many cases, this will be underpinned by research that is going to keep Canadian expertise in Canada, improve clinical care in Canada, and develop made-in-Canada solutions. I think we agree that vision health has been undervalued for a very long time, so we're looking to the Senate to try to support Bill C-284.
Thank you, Ms. Moniz. Mr. Bayorgon and Mr. White, please.
Good afternoon, Madam Chair, Senator Omidvar, and to the other senators, members of this important Senate committee. On behalf of the Canadian Council of the Blind, I would like to thank you for the opportunity to speak to you today in support of quick passage of Bill C-284. Celebrating 80 years of dedicated advocacy and support, the CCB was founded in 1944 by returning World War II veterans blinded by war, and is recognized as the voice of the blind in Canada. The Council is tasked with not only representing and advocating the 1.2 million Canadians who are blind, deafblind, and partially sighted, but over the 8 million Canadians living with an eye disease, as Jennifer Jones pointed out, that could lead to blindness. Through advocacy and research, the CCB is dedicated to building public awareness, improving the well-being and quality of life of those living with vision loss. I have provided you with several documents through the clerk's office outlining vision loss, the health communities, support for a national eye care strategy, and my colleagues here today look forward to your questions. With that being said, I'd like to introduce you to a man of lived experience, the president of CCB's Toronto Visionaries chapter, Ian White.
Thank you. It is an absolute privilege to be here to speak before you today. I want to echo some of the comments that have already come forward by saying that prevention and treatment and research are absolutely critical to avoiding unnecessary loss of sight. And this act has at its core the desire to minimize the number of people who will experience vision loss. But there will always be a number of unpreventable incidents of vision loss and blindness. There are people who encounter vision loss later in life, as I did. There are people who are born blind, and those who lose their sight very early in life. And unfortunately, despite best treatment that's available today, those people will lose their vision and need to be supported. Though many of us are undergoing treatment for a variety of eye diseases, many of us don't see ourselves as sick or as needing treatment. We're different, we're disadvantaged, but we're not ill. And I think that's a distinction that needs to be really clearly understood. Diagnosis and treatment for a condition affecting health is a patient's journey. But once a patient's medical journey is complete, the full social impact of vision loss on a person's life and their journey as a person with a visual disability begins. All Canadians with a seeing disability, despite their medical prognosis, those who are patients and those who are not, must be included in this strategy if they are to maximize their independence, improve their quality of life, and integrate fully in Canadian society. The difference in levels of care between those receiving rehabilitation services for vision loss and those receiving other kinds of rehabilitation service is both substantial and unacceptable. Existing programs and supports for those living with vision loss are currently inadequate, unevenly distributed, and represent a major barrier to the inclusion and prospering of millions of Canadians living with vision loss today. For example, one of the best funding systems in the country for visual aids, Ontario's Assistive Devices Program, it purports to support the purchase of visual aids for people who need them. There are nearly 500,000 Ontarians who are eligible for that funding support, but only 1% of eligible Ontarians actually access that funding. The funded devices are out of date, and they don't address the current needs of people living with vision loss in 2024. This woeful statistic extends to all provinces where supports are available. And some jurisdictions in Canada have no support for visual aids at all. This is why a national strategy is so vital, to ensure that all jurisdictions across Canada, that all Canadians who are living with vision loss can equitably and easily access the vision rehabilitation care they need. In keeping with Canada's adoption of the United Nations Convention on the Rights of People with Disabilities, this act is a vital step in Canada's commitment to respecting the rights of people living with seeing disabilities, in honoring that commitment by listening carefully to the voices of those with lived experience, and to honoring the spirit of nothing about us without us. In developing the regulations that will define the effectiveness of this landmark legislation, the Government of Canada must rigorously consult with individuals who have lived experience and with all the stakeholder organizations that represent the interests of people living with vision loss in Canada today. It's our view that any potential shortcomings in the language of the current legislation can be addressed during the creation of regulations, if there is adequate consultation.
If you all go to the Senate Committee on Science and Technology, you can hear the full document from last week, and you could also hear what was said today. He's the Senior Research Officer at the Canadian Council of the Blind. He's the past President of Research at CNIB, past Research Director at Blind and Low Vision New Zealand. Dr. Gordon is also the Adjunct Professor in the Department of Ophthalmology and Vision Sciences at the University of Toronto, and was the Principal Investigator in the report card in 2022 and today's result. Ladies and gentlemen, my partner in crime, Keith Gordon.
Thank you very much, Michael, and I'd like to thank all of you for coming out here today to hear about the results of our report card and to be here for discussion later on. It's this kind of collaboration that has been pointed out several times that lays the groundwork for future advocacy and future planning for eye health. So thank you for being here. Can I have the... Yeah, that's right. Thank you. My computer's not hooked up to that, so I've got Mohammed changing slides. Okay. As a bit of background, we've been on a fairly extended set of studies to look at the issues and numbers behind the cost of vision loss in Canada. In 2019, we initiated a study which we commissioned to look at the prevalence and cost of vision loss in Canada. The following year, the pandemic hit us, and we felt it was important to update this. So we did an addendum to the cost of vision loss in 2020. 2 years later, in 2022, we decided we needed to look at how the pandemic was progressing and what impact it had on vision health. And we conducted the first report card, the 2021 report card, where we wanted to see whether there'd been any recovery so far from what was reported in 2020. And here we are in 2024, where we're looking at the report card for 2023 to see if the beginning of recovery that we saw in 2021 was progressing, and then whether we were experiencing any lasting impact of the pandemic. So that's in a nutshell, the background of the various reports we put out. The current report, just to give you a little bit of background on the methodology we used. We used Canadian data from a wide variety of sources, information from Canadian Institute of Health Information, information from the Canadian Institute of Health Research, pharmaceutical data from IQVIA that does an audit on pharmaceutical information, and a number of other sources. We conducted a number of literature reviews, and Ian White will be talking to us about some of the literature reviews that he did on the ADP program. We conducted interviews with ophthalmologists, interviews with optometrists, and we did a survey of optometrists. So, in a nutshell, the findings were that by and large, vision health has returned to the situation that existed prior to the pandemic. So we've gone back to where we were in 2019, but that backlogs in service that were created by the pandemic have not been overcome. So good, we've gone back to where we were, but not so good in that we still have a backlog that hasn't been overcome, and wait times and other services are still experiencing the challenge of the backlogs that were created. So, first of all, if we break that down into some of the subcategories that we looked at that led us to this conclusion. First of all, eye surgery we felt was happening. We were back to where we were in 2019, but it's not happening quickly enough. Looking at the numbers, we showed that there were 4% more ophthalmic surgeries performed in Canada in 2023 compared to 2019, and that all categories of eye surgeries were above pre-pandemic levels. So cataract, glaucoma, refractive surgery, corneal surgery, they were all experiencing levels that were as high or slightly higher than pre-pandemic, but they had not overcome the backlog. And the backlog is reflected in the increasing wait times. And we showed that the metric that we used is to look at the number of days to achieve 90% of people in Canada having had cataract surgery. We showed that in 2019, this number was 219, and the number had increased to 241 in 2023. So there's been a 10% increase in wait times of people waiting for cataract surgery. When talking to ophthalmologists, we've found that staff shortages still remained a critical issue impacting the delivery of surgery. So even though surgery is being funded, extra funding is being given by the provinces to various hospitals and surgical units, even though that money is being given there, they're not able to increase the volume because of the shortage of staff. So just to look at the numbers of how the wait times have progressed over the last 5 years, in 2018 and 2019, the number of days that 90% of people were waiting for cataract surgery was 218 in 2018, 219 in 2019. Sounds like good numbers. And then all of a sudden, things took a jump. In 2020, the number went up to 310 days waiting for cataract surgery. That was the worst year of the pandemic. Then things came down a bit in 2021, came down to 256 days. And 2022 went up a bit again. And in 2023, it's down to 241. So it's gone from 219 to 241. That's not acceptable. We can't keep increasing. And that backlog is not... Nobody is taking a dent, a chunk out of that backlog. So the future does not look bright unless we can get into the eating away at the backlog. So what's happening in eye doctors' offices? That was surgery. What's happening in the optometrist and ophthalmologist's office? Well, we don't have real numbers that show the number of people coming into offices, but we use a couple of proxies. The first one was to look at the total ophthalmic pharmaceutical usage. We showed that total all ophthalmic pharmaceuticals showed a 9% growth over pre-pandemic levels. So we are back. If that's an indication of how many people are coming into doctors' offices, we are back to where we were, or slightly ahead of where we were in 2019. We showed that the growth in pharmaceutical usage over 2019 occurred in all categories of drugs. So it's treatment for glaucoma, treatment for retinal diseases. They all showed an increase. To me, that indicates that people are back in the doctor's offices, attending their appointments as was happening in 2019. So what's happening in optometrist offices? Once again, we don't have proxies, but we looked at the overall we don't have actual data, but we do have a proxy. We looked at the overall expenditure on vision care and showed that it had increased by 24% from 2019 to 2023. Now, there are other things built into that. The optometrists in Ontario, for example, had an increase in their fees over that period of time. But overall, things look good. People are back in their optometrist offices. The expenditures continue to increase. One real positive thing we found talking to ophthalmologists and optometrists, they told us that 2 years ago when we talked to them, almost all doctors said that they had experienced patients coming to their offices who had lost vision unnecessarily due to not having eye examinations during the pandemic or not keeping up with their eye medications. This time we found nobody told us that. Everybody said that the people presenting in their clinics they never saw anybody with irreversible vision. Unnecessary irreversible vision. I'm just going to go through that. Okay. So moving on from there, can you go to the next slide? Okay. When we looked at the funding for vision research, and Larissa spoke about this quite eloquently at the Senate Commission, we found that in 2019 and 2021, there had been no movement at all in the total funding for vision research in Canada. In 2023, we found there was an increase of about 25%, but the amount is $26.2 million. Now, this is the total funding for vision research for all types of vision research, ranging from psychological research all the way through to laboratory research related to genetics or genomics or you name it. And this is funding from all sources, from the Canadian Institute of Health Research, from Fighting Blindness, and from other charitable donations. So it's appalling that in a country of this size, where the Canadian Institute of Health Research budget is somewhere around $1 billion, that vision research is getting a miserable $26 million from all sources. I'd like to talk a little bit about the need for regular eye exams. Every ophthalmologist and optometrist we talked to mentioned that the most important thing that they thought that an individual can do for their vision health is to have a regular eye exam. So we thought it was important to assemble the data that we have on are people actually having their regular eye exams. And I've listed here a number of surveys that were conducted by Leger in 2023. Some were conducted for the Canadian Ophthalmology Society, some for the Canadian Association of Optometrists, and some for other organizations. But I've got all the data here, and I'd just like to run through it. 38% of respondents in one survey said they were overdue for an eye exam. So they knew they were overdue, but still hadn't done anything about it. So that's more than a third of people are not going for regular eye exams. 35% of respondents would only book an eye exam if they experienced vision issues. And this is what we hear all the time. We hear from our friends, optometrists and ophthalmologists are hearing from their patients all the time. Oh, I don't need to go and have my eyes checked. There's nothing wrong with my eyes. I don't have any pain. I can see pretty well. Why would I have my eyes checked? So we found that 35% of people agreed with that. And as we know, most eye diseases are asymptomatic. You don't know that you've got them until it's too late and you lose vision. So it's really important. The only way that these diseases can be identified in the early stages is by regular eye exams. Almost half of respondents, 46% of respondents, said that worsening vision over time would motivate them to increase the frequency of their eye exams. So basically you're saying if you can't see very well, you're going to go and see an optometrist or ophthalmologist. Well, that's unacceptable. I mean, you have to go in for regular exams whether you can see well or not. 71% of Canadians expect at least one early warning symptom of glaucoma. Now, glaucoma really has essentially no symptoms in the early stages. Yet 71% of people expect that they'll get at least one early warning symptom if they had glaucoma. Well, that's not the case. You've got to go and get your eyes checked. 74% of Canadian adults say they get their eyes checked at least once every 2 years. That means that 26% of people are not. And the 2 years is the Canadian Association of Optometrists' recommendation for adults aged 20 to 64. They say people in that age group should be going every 2 years. Over 64, people like me should be going every year. 45% of people said that they get their children's eyes tested every year. So 74% will get their own done every 2 years, but only half of them, 45%, will get their kids' eyes tested every year, which is a CAO recommendation for kids aged 6 to 19. So it's essential if you've got kids or grandkids, make sure that they go and see an optometrist or an ophthalmologist every year. So that's my little speech about regular eye exams. Thank you for listening. I'll move on. Okay, so why is that important? Well, all sorts of reasons. I mentioned the early detection of eye diseases, but also we're currently experiencing globally a myopia epidemic. Myopia is short-sightedness. Prior to the pandemic, this was happening all around the world. There were more kids in particular getting more myopia over the few years before the pandemic. And along came the pandemic, and optometrists were reported seeing an increase in the prevalence and severity of myopia among their patients. And this is put down to two reasons. The first one is that people during the pandemic, we were all isolated, mostly isolated indoors, and people are spending less time outdoors. There's data from throughout the world, including Canada, that shows that kids who spend more time outdoors have less myopia. Let me say that again. The more time you spend outdoors, the less myopia you have. So it's really important to get outside. At the same time, we've all been cooped up during a pandemic, and involved with education via computer, doing Zoom meetings all the time. So we've been spending a lot of time on screens. And the other reason that's attributed to this growth in myopia is the amount of time that kids in particular have been spending using digital devices. Okay, so another issue we identified, we looked at a number of emerging issues. So the first one was the myopia epidemic. The second one was the access to gene therapy. And Larissa had talked about the first gene having been discovered and approved in 2020 by Health Canada. Sorry, it wasn't discovered by Health Canada, it was approved by Health Canada in 2020. It was the first gene for an inherited retinal disease. The disease that it treats is retinitis pigmentosa or Leber congenital amaurosis. And it's only for people having a particular gene, the RPE65 gene, of which there are fewer than 100 people in Canada. So we're not talking about massive numbers of people being treated by these new genes. But the good news is that there are a large number of gene therapies for eye diseases currently in clinical trials. The challenge is going to be that because there are a small number of patients with each genetic defect and each gene therapy that's coming out, these treatments are going to be very expensive. And it's really important to start laying the groundwork with government to understand that, yes, the particular treatment is expensive, but if you look at the life cost of vision loss to the individual being treated, it's much, much greater than the cost of the drug. So it's really important to get that message across and to start getting that message across now, before these medications come out and before I say, oh my God, that drug company is asking whatever it is for their drug. We are privileged to have these medications coming. We need to make sure that they are funded so that people don't have to experience unnecessary lifetime of vision loss. On the good news front, another emerging issue is that there are now treatments available and under clinical investigation for geographic atrophy. Geographic atrophy is an advanced form of dry macular degeneration for which there's previously not been any treatment. We estimated in our report card that there are about 140,000 Canadians living with geographic atrophy. And let me repeat, for which there's currently no treatment. The good news is that there are 2 drugs currently approved in the United States by the US FDA that are not yet approved in Canada that are offering hope to people with geographic atrophy. These aren't cures. You're not going to take these drugs and suddenly be able to see tomorrow, but they slow down the rate of vision loss due to geographic atrophy. And every ophthalmologist I've talked to on the subject says that they will have a major impact on how geographic atrophy is treated. Okay, moving on from geographic atrophy, another emerging issue, and we had a conference on artificial intelligence in May, and I hope many of you were there. So I'm not going to repeat a lot of what we discussed in that conference, but artificial intelligence offers huge opportunities for in a number of ways of treating eye diseases, of diagnosing and treating eye diseases, and of helping with vision rehabilitation. I did a little review of the methodology of the various forms of artificial intelligence and how they can help in the treatment of vision health. And I'm just going to summarize it very quickly here. Firstly, artificial intelligence is useful in the diagnosis of eye diseases. They're shown to be highly accurate in diagnosing a variety of eye diseases, in particular diabetic retinopathy, glaucoma, and macular degeneration. So the earlier you can diagnose these diseases, the earlier you can treat it, and you can minimize vision loss associated with these diseases. Artificial intelligence makes that possible. Screening for diabetic retinopathy is AI has been shown to be useful in screening, particularly in rural and remote areas. So you can send a nurse, for argument's sake, into a nursing station in a very remote area, take a picture of the back of the eye through a fundus camera or an OCT, and have the AI associated with those devices diagnose whether that person actually has diabetic retinopathy. What that means is that that person, if they don't have diabetic retinopathy, don't have to come into an area where they can be treated, like Edmonton or Calgary or Winnipeg. But if they do, you're only going to be flying in the people that need treatment. So I think the impact of early diagnosis that AI can have in rural communities is huge. AI has been shown to be useful in the screening and diagnosis of cataracts and for planning cataract surgery. It's been shown to be useful in triage and practice management, both in optometry and ophthalmology. More efficient practices enable better utilization of resources, of medical resources and optometric resources. And finally, we had this great presentation at our meeting in May on the use of AI for the development of new accessible technology for people who are blind or partially sighted. And I just mentioned some of the devices that have already been developed with AI. There's one called Be My AI, Envision glasses, Ray-Ban Meta smart glasses, and Celeste smart glasses. What all of these are glasses that people wear that you then go and look at an object or a scene, and the AI will describe to you what that object is. Or I'm looking at the face of the rock star Ian White, and it tells me that's Ian White, and he's walking across the floor, and he's going to give a brilliant speech again. So these glasses are life-changing, and they are in use now. Each has different capabilities, and they come at different price points. But it's life-changing. We decided to have a small look at the issues related to Indigenous eye care. We talked to 3 Indigenous optometrists about issues that they're facing in their practices working with Indigenous populations. And this is not meant to be all-encompassing. It's our findings from these discussions, and I think that it can lay the groundwork for looking at this issue in a more holistic manner and more completely going forward. Indigenous patients tend to have poorer eye health than non-Indigenous patients, we were being told. There was a generalized mistrust of the healthcare system, and I think we're all aware of that, and a lot of that goes down to issues associated with colonization. They told us that new models of healthcare, especially models that include Indigenous practices and practitioners, are necessary. I say Indigenous practices and practitioners. We found that there really are only 3 Indigenous optometrists in Canada, and there's 1 in training at University of Waterloo. That's not acceptable in this country. We need to do what we can to encourage Indigenous people to go into optometry and ophthalmology. we were told that government programs such as the NIHB is the non-insured health benefits, which is a method that the federal government used to fund eye examinations for Indigenous people, and they also fund eyeglasses. But they told us that programs such as the NIHB are problematic. That while the NIHB does provide a pathway to accessing care, it's burdened by complex bureaucracy and outdated processes that create barriers both to the patient trying to get reimbursed and to the optometrists that are being reimbursed by the NIHB. Red tape. They told us that Indigenous Canadians are not getting checkups as regularly as non-Indigenous groups. And I've got a quote here that's one of the optometrists told us. They said about 20% of the kids I see on reservations have refractive errors that should be corrected. So 20% of kids on reservations are walking around not being able to see just because they don't have glasses. I mean, that's not acceptable. We've got to do something to fix that. Okay, the last issue that we identified was the need for a national assistive devices program, and the rock star Ian White will be telling us more about it. So, and finally, I have here an update on the national strategy for eye care. I don't think I need to say anything more about that since it's been covered a couple of times today. So I'll move on. So in conclusion, vision health is recovered to pre-pandemic levels, but backlogs remain and wait times continue to grow. We identified a number of emerging issues in this report card that need to be considered when a national eye care strategy is developed. And part of the reason for looking at a number of these issues, such as myopia growth, is that we hope that these issues will form some of the basis for discussion when the National Eye Care Strategy people get together. A national vision health strategy is essential to provide the best possible outcomes and quality of care for all Canadians and the best visual rehabilitation for Canadians who are blind or partially sighted. And I think it's important when we look at the issues that emerge from the national strategy for eye care to make sure that at every discussion point that vision rehabilitation is included in that discussion. There's a tendency to look only at the medical issues. We think it's really essential, as Ian pointed out at his presentation to the Senate committee, it's really critical that vision rehabilitation be included in all aspects associated with the National Eye Care Strategy. So in 2019, we began a journey designed to measure the milestones along the long road to improved vision health. The journey was interrupted by the pandemic. So in conclusion, we are now back on track and poised to improve vision health nationally when Bill C-284 is enacted. Thank you very much. Okay, with that, I would like to introduce Ian White, who is the president of the Canadian Council of the Blind, Toronto Visionaries.
Good morning, everybody. I wish I'd brought my air guitar. Would have made this a lot simpler. Thanks for the opportunity to speak to you guys today. It's a real honor and a privilege to be here. I'm going to talk briefly about assistive device programs across the country and just sort of sketch out what the landscape looks like and where work needs to be done to improve access to assistive devices for people with vision loss. I'm going to start with a definition. I use the term assistive technology. A lot of assistive device programs use the term assistive device, but I find that device actually means both physical devices and certain software and aggregated technologies that act in an assistive capacity. So I want to make sure you guys understand that when I'm talking about assistive technologies, I'm talking about assistive devices as they're defined under these programs, and specifically with reference to visual aids, because while there are a lot of programs across the country that do provide assistive devices to a variety of disability categories, vision aids are often left off the table. I'm going to go through this in a fairly scattered way, but I'm hoping that at the end of it, we'll be able to pull some threads together and see where we go from here. As I said, in many cases, there are assistive device programs that you can look up online. Most provinces and territories will say that they have assistive device programs. And these are to cover all kinds of differing disabilities, everything from wheelchairs and other mobility devices, home oxygen, prosthetics, diabetic supplies, those sorts of things. But what does vary quite a lot from jurisdiction to jurisdiction is whether or not visual aids are covered. And quite often what we find is that although various provinces and territories have assistive device programs, they don't cover vision aids. In February of 2022, the CCB issued the survey report reforming the assistive device program in Ontario. It was a comprehensive snapshot of accessing funding support for visual aids in Ontario, specifically from the user's perspective. And I think that's really important. There have been a number of studies done on a variety of programs, but usually from an administrative or a political stance, very seldom from the user's perspective. So I think this report was actually quite impactful. The report showed that while in need of substantial reform, access to current accessible technologies is absolutely vital to support the inclusion of blind and visually impaired Ontarians. One of the first questions the study addressed was, is there actually an economic need? Is there a requirement for government to get involved in funding assistive devices? It's actually really well documented that Canadians with vision loss are one of the most economically marginalized communities. People with vision loss are twice as likely to live in poverty, and these are statistics that have been confirmed in the recent work done at StatsCan on disability across Canada. According to the survey report, about 1/3 of respondents had a pre-tax income of $35,000 or less. 42% said that they were living on less than $50,000. So that's a huge chunk of the vision loss community that is actually living a very meager existence. 1/3 of respondents were working, and that includes all forms of employment, full-time, part-time, self-employment. And 70% of the respondents to the survey said that they couldn't have afforded to purchase their assistive devices without funding assistance. So there's a whole lot of blind and partially sighted Canadians who just aren't able to afford their own purchase unaided of the visual aids they need. The next question that was addressed that I think we should address is there sort of political interest in supporting people in this way? And I think in fostering the inclusion of Canadians with vision loss, there are sort of three key pieces of legislation that have come out in the last couple of decades that indicate that there is a willingness to address this issue, and that suggest fostering inclusion is a priority. First, in 2008, Canada adopted the UN Convention on the Rights of People with Disabilities, and that convention enshrines the rights of all people to live with dignity and have full access to all aspects of the society in which they live. The Accessible Canada Act in 2019 further enshrines those rights, especially with respect to equal access to all government services and Crown corporations. The Canada Disability Benefit also addresses this issue by addressing the issue of chronic poverty in the vision loss community. And even the AODA, the Accessible Ontarians with Disabilities Act, passed in 2005, has really sort of tried to push for a more equitable accessibility for folks with vision loss and all kinds of disabilities here in Ontario. The idea of these pieces of legislation is to ensure that we all have equal opportunity to pursue our own goals and live the fullest, richest lives we can. The Canada Disability Benefit, as I mentioned, recognizes the economic marginalization of people with vision loss. And the principles guiding the Accessible Canada Act include that everyone must have equal opportunity to participate in all aspects of Canadian life. But as the nature of society changes, as we move towards full digital access to all aspects of our lives, including accessibility and access to government services, in an increasingly digital society, what this means is ensuring affordable digital access to all aspects of modern life. And this means providing equitable access and affordable access to the assistive technologies that make such digital access possible. Affordable access to assistive devices helps to lift Canadians with blindness out of poverty, enabling them to pursue their life goals and participate more fully in all aspects of Canadian life. This includes access to education, work, finance, recreation, leisure, political engagement, and much, much more. It's therefore essential that all Canadian provinces and territories have some sort of support for an accessible devices program that helps people with blindness and low vision acquire the assistive technologies that they need to fully participate in their lives. The question is, do we have such access? There are programs, but do we have access? Are all Canadians able to get hold of the devices that they need? So what does the existing landscape look like? Over this past summer, a non-exhaustive study was undertaken, and this is something that's definitely going to need a deeper dive to get at some of the nuances, but just a broad general survey gave us the following findings. Many provinces and territories have some kind of a program, but each province under Health Canada actually sets its own priorities and its own funding allocations and its own decisions regarding what it will fund and what it will not. So the extent, funding, and restrictions on support programs for assistive devices vary widely. The most robust programs are in Quebec, Ontario, and Alberta, and this kind of makes sense. We're the sort of have provinces. There are restricted programs in British Columbia, Saskatchewan, Manitoba, PEI, and the Northwest Territories. There are actually no supports for visual aids at all in New Brunswick, Nova Scotia, Newfoundland and Labrador, the Yukon, or Nunavut. Nothing at all. The non-insured health benefits program, which applies to Indigenous communities, funds a limited number of visual aids, but only where no territorial or provincial program exists. So geographically, the landscape is really varied. How do the actual individual programs vary, where they exist at all? Most programs have either total funding limits as an aggregated funding total, or they limit the amount of money being spent on an individual device. For example, Ontario limits access by setting a cap on the amount spent per device and limiting the number and type of devices that are available through the program. Manitoba, on the other hand, has an aggregated limit of $1,500 for all devices, regardless of what's prescribed. Most programs are cost sharing. So, for example, in Ontario, the ADP program is a 75-25 cost split, where 75% of the cost of the device, or rather 75% of the funded amount, is borne by the province and 25% is borne by the client. And this does not include any applicable taxes. Only Quebec offers devices on a loan program. So the province actually owns the equipment and loans it out indefinitely to recipients. Some programs are limited by age. For example, Prince Edward Island, BC, and Manitoba all exclude seniors and in some cases exclude children from accessing funding for devices. Some are limited by ability or intention to go back to work. Some offer daily living aids, some don't. Very few programs fund computers. Just as an example, the ADP in Ontario funds computers. They fund desktop computers, laptops, and tablets. But they don't fund them because they're digital access devices. They don't fund them because they're internet connective. They fund them because they're writing devices. They are, in essence, elaborate typewriters. There's actually only one jurisdiction in Canada that we found, the Northwest Territories, and possibly in some cases in Manitoba, where a smartphone can be funded as an assistive device. So some jurisdictions have programs for visual aids, a number don't. Even where programs exist, they vary in restricting access, limited eligibility, limited device types, or just exclude large segments of the population. But beyond the disparities between these programs and the portions of the population excluded, from a policy standpoint, there's a deeper question. Are existing programs actually effective? Are they actually doing what they purport to do? Are they actually providing visual aids to the people who need them? Each of the programs we surveyed faces a unique set of challenges. Rules for eligibility, the funded amounts, limitations that are placed on the program through that. And these vary widely from jurisdiction to jurisdiction. So one of the things that is concerning about the disparities between jurisdictions is that there's a general provision in the Charter that says that all Canadians should be able to pursue their life aspirations, their employment aspirations, regardless of where they live in Canada. and this is called a portability provision. But with the unevenness of access to the visual aids that can enable things like pursuit of employment, it's hard to see how I could be able to move to somewhere like New Brunswick and still have the kind of rehab support that I need. So there's some fairly fundamental ethical considerations to be worked through here. I think one of the things that we found is that the uptake in these programs is actually quite low. The example that we used is information that we were given from the Ontario ADP bureaucrats themselves, which indicates that of the nearly 500,000 people living in Ontario alone who are eligible for funding support through ADP, the actual uptake, the actual number of funding applications received by the program is about 1% of that number. It's about 4,500 to 5,000 funding applications in visual aids through ADP a year. So literally 1% of the people in Ontario are receiving funding support from the ADP program. So I think that the ultimate upshot there is that 99% of the people in Ontario aren't accessing the funding that they're eligible for, and there have to be reasons for that. It could be that there simply aren't enough referrals to the program. It could be that the process itself is too heavily weighted on the initiative of the client who's struggling with vision loss to move the process forward. It could be that the wait times are too long. In some cases, we've received both information through the survey report and anecdotally that wait times to receive a device in Ontario can run from several weeks to several months. And if you're relying on those technologies to advance your life goals or even get back into a work situation, those wait times are just unacceptable. So it could be that the existing product manual is out of date and that the program itself suffers from a lack of policy update. Just as an example, one of the things we discovered in reviewing the policies for ADP was that the essential or foundational assumption that underpins the visual aids category is that the major obstacle to be overcome was a print disability, which was true in the 1970s and early 1980s when the program was set up. That was before there was an internet, before there were smartphones, before there were computers. Today, the actual need is for digital access and to have access to the kinds of devices that support the kinds of applications and software that are being developed. As Keith mentioned, a lot of the AI tools that are out there, a lot of the applications that are used for magnification, for screen reading, for interpreting images, for wayfinding, for navigation, are all built for digital devices like smartphones. There's also evidence of bias from the policymakers, especially the ADP. In interviewing the ADP bureaucrats, we encountered several examples where there was just a profound lack of understanding of the need for these devices. Just as an example, from the survey report, 76% of respondents indicated that a smartphone was their most valuable primary accessibility tool. ADP refuses to fund smartphones pretty much on the grounds that, first of all, they don't consider it an accessibility tool because it's a mainstream device. And they don't fund mainstream devices despite the fact that they fund computers, laptops, printers, scanners, tablets, all of which are mainstream devices. So there's something else going on there. BC, Manitoba, and Prince Edward Island will only fund equipment if the applicant is intending to go back to work. And this excludes seniors, which make up about 45% of the vision loss community. If the ADP example of only serving 1% of the population is expanded across the country, basically what that means is that of the 1.2 million people living with vision loss, fewer than 10,000 are actually being supported by these programs annually, which is just an appalling statistic. So this funding is really for a range of, sort of outdated equipment that doesn't really address the current needs of folks. And yet the potential for these programs to have a huge positive impact is really enormous. The people who do receive funding, who do receive these devices, report that their lives are substantially and positively altered, and that they are able to now pursue their life goals, they're able to pursue their interests, they're able to pursue employment because they actually have access to the tools they need. So what is the current cost? What are we currently spending on these programs? Two of the most unrestricted programs, Ontario and Alberta. In Ontario, the ADP program spends, of its $620 million budget, it spends $2.9 million on visual aids, which, if my math is right, is 0.5% of the total. Alberta spends about $650,000 annually. If we extrapolate those current funding levels to the other jurisdictions where these programs exist, the total aggregated funding for assistive devices across Canada would be under $6 million. Yet even at these vanishingly low levels, the positive impact is substantial. So I think that with reform, guided by appropriate consultation with stakeholder organizations and with people who live the experience of vision loss, this rather bleak, uneven landscape could be leveled into a more even, more equitable, and transformative system. And I believe that if we were to properly fund assistive devices equitably across the country, we could unlock the human potential in all of the people with vision loss who are currently struggling to gain access to the daily lives that most Canadians take for granted. The problem is leaving the assistive device program structure and funding and policies to the provinces means leaving it to the individual jurisdictions to decide where their priorities lie. And to try to piecemeal this and convince 13 different jurisdictions that they should hold the same set of criteria and place the same importance on these programs is a near impossible task. I think this is why I would really strongly encourage the federal government to mandate and implement, as part of the Vision Health Strategy, a comprehensive plan to include assistive devices as part of the rehabilitation strategy for Canada. I'm going to leave it there. I'd be happy to field questions at the end when I think we're going to set up a panel discussion. But I thank you for your time. It's been a real privilege to be able to speak before you today. Thank you. I understand that it's also my privilege to introduce Larissa Manise. Dr. Manise is from Fighting Blindness Canada and is going to take the podium next.
I'm Larissa Manise. I'm the Director of Research and Mission Programs at Fighting Blindness Canada. I've had the privilege to work with Dr. Keith Gordon on the report card this year, and also the pleasure to meet Ian last Thursday when we were in Ottawa talking in front of the Senate. So I'm only going to be talking for a few minutes. I just wanted to share a little bit of Fighting Blindness Canada's perspective on the report card. And I know we're going to have a much bigger discussion about this later this afternoon after we hear from representatives from the Canadian Ophthalmological Society and the Canadian Association of Optometrists as well, who are going to give their perspective as healthcare providers. So I think both Keith and Ian really laid the scene nicely for Keith talking about what's the state of Canadian vision health right now. And as he mentioned, it's good to see that after the pandemic, many metrics of the system seem to have recovered from backlogs during the pandemic, but not all of them. But also, I think, really highlighting some of the challenges that as a vision healthcare stakeholder group we are facing. So on the left on the screen, we put together an infographic to highlight some of the key themes that came out of the report card, which I think will be a great tool for advocacy to share with stakeholders, whether that is governments, whether that is healthcare providers who are interested, or even potentially community members. But what I really see as the purpose of this report card, now that we have sort of seen where we are, and we've seen that the healthcare system is, I guess, in a recovered state, is that this now becomes our new baseline. It becomes where we are starting to look forward from. So where do we want to be in 5 years? Where do we want to be even in 10 years? And I think the National Eye Care Strategy, which we've talked a lot about, is going to give us a really great opportunity to start to, as a community, have those discussions. I think most of us will agree that the system isn't quite meeting our community members or patients' needs today, but where do we want it to be? So I'm really looking forward to starting to have those discussions later on this afternoon or today about what do we think is the appropriate wait time for a cataract surgery? How many people should be getting an eye exam every year? What is the appropriate goal that we are aiming for? Of course, 100% is great, but how do we move that number up from, I think, Dr. Gordon was saying that 45% of children are getting an eye exam every year. We definitely want that to be higher. So how do we start to make those incremental steps? From Fighting Blindness Canada's point of view, an area we look at quite closely is research. And so, as Dr. Gordon mentioned, in Canada we're spending about $26 million on research, on vision research every year. It's a rough figure, and it's partly because there's no easy way to track what funding is actually dedicated to vision research. But we know in the United States, they have a dedicated eye institute called the National Eye Institute, which gets $900 million a year. And so even if you sort of adjust for population, we are probably about 4 times less funding on vision research in Canada than we would like to be. So from our point of view, how are we going to start to move the dial on that to get more federal funding, more provincial funding that is really going to support all aspects of vision research, from discovery to treatments, but also to demographic data and vision rehabilitation data, all of which is important for improving outcomes. So yeah, that's sort of it for me today. Don't want to keep us, although I'm not too sure if lunch is ready, Michael. So if I end now, I think there's more time for networking, but I could just stand here and blather on for a bit longer, but I don't think that that's necessary, especially since we've already heard a lot about the key messages from our talk at the Senate earlier this week. So I'm going to turn it over to Michael now, who will tell us what we're doing next.
This afternoon, Dr. Phil Hooper, immediate past president of the Canadian Ophthalmological Society, and Dr. Alison Scott from the Canadian Association of Optometrists will speak, and then at that time we'll have a question and answer period, and I understand there's a lot of questions coming in right now. So with that, morning session is over. I'd like to introduce the immediate past president of the Canadian Ophthalmological Society, Dr. Phil Hooper.
Okay. Well, on behalf of the Ophthalmologists of Canada, I'm very honored to have been invited to speak to you this afternoon. I'll hopefully be a bit entertaining and provide some useful information. This is an important effort and one that I hope will pay off dividends going forward. I think most of you know who an ophthalmologist is, or think you do, but we've variously been described as the narrow end of the eye care funnel in Canada. One of my preceptors in medical school, when I indicated that I was going into ophthalmology, indicated that I was now going to know almost everything about almost nothing. So that's another way of looking at it. I guess the good news is that over the past 40 years that I've been involved with ophthalmology, the almost nothing has expanded greatly, and as you've heard, is poised to expand even more. Dr. Gordon's given a really good overview of the Vision Care report. I'd like to emphasize 4 different areas which I believe are on the slide there. One being workforce as it respects ophthalmology, access to eye examinations, access to drugs and devices, and again, research funding. With respect to the ophthalmology workforce, we're treading water. Basically, we have the same ratio of ophthalmologists to population as we did in the 60s, and we're able to keep current with the number of people retiring. But virtually all of the workforce that has grown has occurred through immigration. And that is a very vulnerable situation to be in because you're attracting very specialized people from other countries. With respect to the population over 65 who use many more of the eye care services, we have a declining ratio, now sitting at about 18 per 100,000. And like the rest of the Canadian workforce, we're getting older. We started out in the 70s at about 10% of our workforce being over 65. We're now sitting at 20%. What are we going to do about it? One of the problems is that, as you've heard, there are many new diseases we can treat. When I started in practice, macular degeneration of all kinds was something we said, you have it, you're not likely to do well visually, here are the supports available in the community, and I'm sorry that's all we have to offer. Now we can treat and actively do so for wet macular degeneration, and we're poised on the threshold of doing so for dry. Similarly with glaucoma, there are now many more ways of treating it. So the number of treatments that we expect to be able to provide in the near future is going to massively increase without an appreciable way to increase the workforce. So how are we going to deal with that? I think there is an opportunity here. As you know, the medical school enrollment across Canada has increased dramatically. New medical schools have been created. Those will all have to be echoed with training, postgraduate training positions. And can we make a case to scoop some of those for ophthalmology? I think a very good case can be made because of all of the things that we do and all of the things that we are facing in the future and the importance of vision. And I hope that Bill 284, when it passes, not if, but when, will allow us to address this. But one of the things that we have to continue to work on is that workforce in medicine is determined at an academic level, and there's really no input at this point in terms of what the population needs. So that will need to be addressed. Access to regular eye examinations, and I'm probably behind in the slides if we can go to the first, regular access to eye exams. That's an issue. Dr. Gordon pointed that out. A number of people are overdue for an eye examination. People state, about half the population, that they'll only book it if there is an issue that they perceive as arising. The biggest problem, and again has been mentioned, that of the 4 major blinding eye conditions, 2 of them glaucoma and diabetic retinopathy are totally silent when they initially develop, so that people aren't going to come when they have problems. And that's compounded by the fact that in many jurisdictions between the ages of 19 and 60-something, they're not necessarily covered for regular eye examination. So that's another impediment that exists within the system. So we have an educational issue, and we can work on that, and there are initiatives going on we'll talk about. But there's also a financial legislative issue that needs to be dealt with. Next slide. Canadians aren't aware of the leading eye diseases. They're more familiar with cataracts than anything else, but only a quarter of the population are aware of diabetic retinopathy. And that is a real concern, because when you talk to diabetics, every day in my office I'll have a diabetic come in who is surprised that they have an eye problem, even though they've been diabetic for 10 years. Nobody's ever mentioned to them that eye disease is a part of this disease that they need to be aware of. And so we really need to work on that. When it comes to eye diseases that Canadians are aware of, they're most aware of the things that actually cause symptoms. They're concerned about screen time, UV exposure, exposure to wildlife smoke. That was a big issue with the wildfires in Western Canada last year. And when their eyes are irritating or runny, they've got blurred vision or have headaches, they immediately assume that there is an eye disease going on. And that will prompt examination and potentially treatment, but it won't bring people in who have these silent diseases. So as part of the educational process, we're working with other eye care providers, other people in the eye care system to increase education. We have a website directed to the public called See the Possibilities, that's designed in an informational and a very interactive way to get people to become engaged with eye health. Moving on to access to drugs and devices. That is an interesting process in Canada. For those not familiar, drugs have a very stepped approach to approval in Canada. Starts out with Health Canada, and they look at the safety of the drug and the evidence for its effectiveness. They have a very rigorous process to do so. Then Health Canada passes it over to Canada's drug agency, and they look at the cost effectiveness. Is this drug actually going to be enough of an advance or provide care in a way that's cost effective? And if so, then it moves forward to the provinces, each of whom individually assess whether or not it's something that they're going to cover in their reimbursement system. The bad thing about this is it's time-consuming and can lead to the Canadian patchwork, where you have one province that covers drug A, you have another province that doesn't cover drug A, and that is very similar, as we heard, to assistive devices. The good thing about this is that usually when a drug lands at being approved within a province, there's some mechanism to provide funding for it, so it has a niche. We don't have something that doesn't have a niche. Not so for medical devices. They're approved in a totally different way. The approval process in some ways is less rigorous. The approval is primarily looking at, can the device, or is it possible for the device to produce harm to an individual? And if that's the case, then it's not approved. But they have a very low threshold of studies and so on to actually show that the device does anything. It's not nearly as rigorous as for drugs. The downside of this process is that the good thing is that we get access much earlier than other jurisdictions, for instance, the US. The downside is that we get drugs like the minimally invasive devices for glaucoma that are approved, but they have no funding mechanism. And so we have a disconnect between having a device that does good and not an ability to fund it and to try to get around this is often a very big challenge at an individual level. Next slide. In terms of the whole overall scene, though, it's a very exciting time with the number of drugs that are coming through the pipeline, as you've heard. I think where we need to move forward is we need to develop a much better ability to work with the approval process, and I think in the last 2 years we have, in order to provide much better input about what are the important questions that they should be asking about a drug or a device, and what's the niche in terms of its use, so that potentially things aren't going to get stuck in this regulatory process. I think that that's one of the challenges, particularly in device or in drugs that are in new therapeutic areas like that in geographic atrophy, dry macular degeneration, where there's a real challenge to try to look away from does it change vision to what is it doing for the overall visual field, the overall visual function. And that's something that the regulatory authorities in Europe and in Canada are having a great deal of difficulty understanding. Moving on to research, next slide, that has already been discussed. I want to bring up, though, an aspect of research that isn't immediately apparent. As we think about research, we think about developing new approaches to therapy, new devices, innovation. But there's another whole part of research that is not well funded in Canada, but is very important, and that is research to bring things that are already out there into Canada and get them funded. And I'll give you an example. Corneal cross-linking, which is a way in which the cornea can be stabilized in a disease called keratoconus. Good research behind it. It has a niche, and it is very beneficial in preventing the need for corneal transplantation in a large number of these patients early on in disease. When it came to actually getting that funded, the device was there, the drug was there was no funding in Ontario, and it became a circle in trying to get funding because the government wanted proof in a Canadian environment that it was going to make a difference. There was no proof, there was no funding to get the proof, and eventually we got the funding, got the proof, and now we have an ongoing way of funding this. And there are many other examples that are very similar. So research funding is important in many instances to actually get the drugs here that we need when we need them. Finally, next slide. What are we working on as an organization? We're doing many things. We're doing public-facing education. We're available to the press to try to help decipher questions that they have that are important, things like the eclipse, the forest fires, all of those sorts of things. We provide education to our members. We try to advocate on behalf of innovation, to see things like Bill 284 move forward, and to work with other people in the vision care space to hopefully make it better in the future. And with that, I'll close. Thank you very much for hearing me out.
Thank you, Dr. Hooper. Our next speaker is Dr. Alison Scott, Vice President of Canadian Association of Optometrists. And I'm calling her up here, and while she's on her way up here, I want to say, from the Canadian Council of the Blind's point of view, working with Fighting Blindness Canada, the Canadian Association of Optometrists, and the Canadian Ophthalmological Society, it's a real treat, and it's really helpful. They got really strong staff people there, Kim, Julie, and working with Larissa and the people at FBC. It's really good, and it's good to see that everybody is working on the same page. So with that, Dr. Alison Scott.
Good afternoon, everyone. Thank you for allowing me the opportunity to speak again. My name is Dr. Allison Scott, and I'm the Vice President of the Canadian Association of Optometrists, otherwise known as CAO. Our current president, I think as we heard earlier, is actually in Ottawa speaking to Bill C-284, so I'm very honored to be able to be here in his place. Thank you for inviting me here today. We're hoping to share some perspectives on the optometric community and about Canada's vision landscape. So the Canadian Association of Optometrists, or CAO, is the national voice of optometry working on behalf of more than 8,300 members that includes optometrists, optometric students, and optometric assistants. CAO represents 83% of the optometrists across Canada. Optometrists are independent primary health care providers and represent the front line of vision care. Optometrists practice in a range of settings, including private practice, collaborative clinics, hospitals, community health centers, corporate optometry, research, teaching, and administration. The total number of optometrists in Canada is now over 7,100. Optometry is a regulated profession where optometrists have completed a Bachelor of Science degree or higher before doing a 4-year Doctor of Optometry program from an accredited university's School of Optometry. Licensure by the province or territorial governing body is required to ensure public receives the highest standards of optometric care. Among their many responsibilities, Canada's optometrists can specialize in the examination, diagnosis, treatment, management, and prevention of disease and disorders of the visual system, the eye, and the associated structures. We can diagnose ocular manifestations of systemic conditions such as diabetes and high blood pressure, and then complications of the aging process like cataracts and age-related macular degeneration. We can prescribe medications to treat certain eye diseases, prescribe and fit glasses or contact lenses, and as well as safety eyewear and subnormal visual devices. We can provide vision therapy and low vision rehabilitation, and we spend a lot of time educating our patients about the importance of vision health and the lifestyle choices for protecting and enhancing good vision and healthy eyes. Some optometrists do conduct research and promote advancements in visual sciences, and importantly, we work in conjunction with other healthcare providers to provide integrated and quality care to our patients. So CAO collects information every year from our provincial colleges and associations. And over the years, the proportion of optometrists has been steady around 17 to every 100,000 Canadians, and this makes Canada one of the top 3 countries global for optometric care. The number of licensed optometrists in Canada has been steadily growing at the pace of the population growth. And recent surveys we have commissioned did not show any signs of labor shortage in the profession, which I think is great news. However, there still are some geographic disparities in the distribution of Canadian optometrists, where larger urban areas generally have greater accessibility to optometrists compared to the rural and remote areas. And we anecdotally know that there are some rural and remote areas that really struggle to find and recruit optometrists and staff. Our GIS mapping project aims to gain a more granular picture of distribution to better understand the spatial distribution and its determinants to make better informed policy recommendations. We're also advocating for initiatives like the Federal Loan Forgiveness Program to encourage optometrists to relocate to rural areas. CAO developed and manages the Canadian Certified Optometric Assistant Program to support optometrists in their practice. In 2024, CAO commissioned a new Leger survey following a similar survey in 2022. This year's survey consisted of an online panel of 2,000 respondents that were surveyed in June. The purpose was to illuminate the challenges and gaps that impact individuals' ability to receive timely and adequate vision and eye care by examining factors such as geographic disparities, insurance coverage, and affordability. The proportion of respondents who have not visited an eye health professional in the last 2 years remains relatively stable it's at 20%, where it was at 21% in 2024. So that means 79% have reported visiting an eye health professional in the last 2 years. The most common reason for the visits included regular vision checks or the comprehensive exam to monitor for particular eye diseases or vision problems. The survey showed that when individuals are seeking vision care services, 76% can access an optometrist in less than 30 minutes. Consistent with the 2022 results, a higher percentage of rural respondents report traveling over 60 minutes to access care compared to those living in urban and suburban areas. Despite these challenges, there are no noticeable differences in delays in receiving an eye exam between rural, urban, and suburban areas, and the delays overall have decreased since 2022, so also great news. The results indicate that availability and access to professionals does not play a significant role in determining whether individuals seek vision care services. A lack of preserved need, nothing's wrong with my eyes or there's nothing wrong with my vision, financial barriers, socioeconomic disparities, overall hectic schedules, and eye health not being considered a priority for patients is the primary reasons for not seeking care. While 65% of Canadians are concerned about their eye health, the survey findings reveal that increased education and awareness of eye health and eye diseases is still needed so that Canadians fully understand the importance of regular comprehensive eye exams. Among the respondents who have not seen an eye care professional in the last 2 years, the lack of perceived need is the top reason, with 43% believing they have no vision issues and therefore didn't need an exam. I think we've heard that a few times today, that is something that we really do need to change, and that the importance of regular exams without vision issues is so important. This number has actually increased since 2022, where 37 respondents reported they had no vision issues as a reason for not going. Looking at demographics of this survey, it encompasses people between 18 and 44 years of age. Although familiarity with cataracts has increased from 62 to 65%, familiarity with the other common eye diseases remains to be largely unchanged. And as we sort of discussed earlier, 46% of Canadians are familiar with glaucoma, 39% are familiar with age-related macular degeneration, 28% with contact lens-associated dry eye disease, and 21% associated with diabetic retinopathy. The survey also looked at children's vision and revealed some of the misconceptions around children's vision. 87% of respondents believe that children should get an eye exam at least once every 2 years, and it is recommended once every year while a child is in school. Yet 45% actually get their children's eyes tested every year. So with the advancements in technology, our everyday lives is increasingly revolving around digital devices, all at work, school, and also when we're home and in our leisure. As a result, there is a rise in eye and vision problems related to digital screen use, known as computer vision syndrome or digital eye strain. The 2024 survey shows that, as in 2022, Canadian adults report spending 7.1 hours on a screen, increased from 6.4 prior to COVID. Parents report their children have an average of 3.8 hours of daily screen time, down from 4.4 in 2022, but still higher than the 2.9 hours reported prior to COVID-19. And these hours are higher than the recommended screen time guidelines from the CAO. 89% of parents believe that prolonged screen time is harmful to their children's eye health, with an increase from 83% in 2022. And among those whose children's screen time has increased since COVID, 6 in 10, or 62%, also agree that increased screen time has negatively impacted their children's eye health. As a vision condition currently affecting 30% of the population, myopia, or nearsightedness, has evolved into a global public health crisis demanding our immediate attention. Myopia is one of the leading causes of vision loss in the world, and the increased screen time, especially in our children, and the increased near work is a risk factor for this disease. By 2050, it is estimated that the myopia prevalence in the world will be at 50%. Along with the rising prevalence, myopia is occurring at early ages, starting at childhood and 6 to 7 years of age, and progressing at a much more rapid rate than previous generations. Once myopia has progressed, that person's vision won't come back. And while glasses can help them see, high myopia is still associated with sight-threatening conditions like retinal detachments, cataracts, glaucoma, and myopic maculopathy. There's clearly a significant need to educate the public about the needs for regular eye exams and their eye health to allow for early detection and treatment of eye diseases that mitigate, prevent vision loss. So the survey that we're discussing really underlines how little people know about the need for regular routine eye exams and the major eye diseases that can increase the risk of blindness without proper intervention. A comprehensive eye exam is the best tool for early detection of eye disease and several systemic diseases. CO's recommendations for the following intervals of comprehensive eye exams for healthy individuals includes the first eye exam between 6 and 9 months for an infant, another exam between 2 and 5 years, and then every year for school-aged children. Adults from 20 to 64, it's recommended every 2 years, and then over 65, it's recommended annually. Keeping in mind that if your eye care professional has identified a concern that either needs to be watched more closely, managed, treated, those recommendations may change on an individual basis as decided by the clinician. Integrating eye care into healthcare routines for all age groups from toddlers to seniors is crucial. While the survey shows that Canadians mainly rely on eye care professionals for information about eye health, we still need to debunk some persistent myths. That is why we are committed to not only providing optimal vision care, but also engaging in conversations with our patients about good habits and raising awareness about eye health all year long. However, ensuring optimal vision care nationwide requires a multifaceted approach. And so one of those approaches is to modernize vision benefits plans. For many years, we've been engaging with the insurance industry because private vision care coverage is still the same as it was in the 1970s. Most group vision benefits plans are old and outdated, and this leads to problems such as late diagnosis, high treatment costs, lower employee productivity, and vision loss. It is time for vision benefits plans to catch up with modern medicine and optometry. Current best practice vision care includes modern diagnostic and imaging like OCT and fundus imaging when recommended by the optometrist during a comprehensive exam. Also, a small percentage of patients, often in the 40-plus age group, will require more follow-up between their regular comprehensive exam. This may be to monitor for signs of disease progression, to monitor treatment, to follow a diagnosis more closely, and to manage their condition. Currently, for many plans, these partial exams aren't covered, but these partial exams should be covered. A recent survey of insurance stakeholders shows that most consider vision care as critically important. Our advocacy initiative is showing better education about vision care and engagement in increased maximums for modern diagnostic and imaging technologies. But now we need to engage plan sponsors, advisors, and employers to fill the gap. We encourage plan sponsors to familiarize themselves with the Vision Benefits Modernization Initiative on our dedicated website, which is the don'tlosesight.ca. You can all be part of the solution. I encourage you to engage your insurers and sponsors to join the conversation. Canada is behind the United States and Australia in developing eye health and vision services for Indigenous peoples. There's a stark contrast in eye health outcomes between the general population and Indigenous peoples who face significant barriers to accessing quality vision care. Indigenous peoples are diagnosed with diabetes younger, face higher rates of complication, and experience poorer treatment outcomes. And Indigenous youth represent the fastest growing pediatric chronic disease sector. Social and financial factors, cultural complexities leading to generalized mistrust of the healthcare system, inadequate federal programs like the NIHB or the non-insured health benefits prevent equitable access to care for these communities. There are steps, however, happening in the right direction. There are several initiatives that exist in different provinces based on mobile clinics, and CAO is supporting a new group of Indigenous optometrists to exchange idea and foster new initiatives focusing on access to vision care for Indigenous peoples. We recently hosted a webinar about Indigenous eye care, and we had over 250 people joined. This is very encouraging. The BCDO, or the British Columbia Doctors of Optometry Rural and First Nations Access Program, is a promising model to gather optometrists outside of the federal government program. Currently, there are 56 communities in British Columbia served, with 20 participating optometrists in 2023. CEO is also working with the Assembly of First Nation Navigators and the NIHB program to enhance access, expand coverage for diagnostic testing, glasses, and preventative treatment, and simplify the process for optometrists and patients to make care as accessible as possible. We know we can do more. CAO urges the Government of Canada to honour its commitment to work in partnership with Indigenous communities as a part of the broader agenda of Canada's Truth and Reconciliation Commission by including appropriate vision care services and collection of data on access to vision services through the Indigenous Health Equity Fund. Our profession is continually evolving. Our pan-Canadian working groups are doing important work with several areas to support the necessary transformation of our healthcare systems and support optometry's scope of practice accordingly. Artificial intelligence, or AI, is already there and will play an important part in our future practice. AI is poised to automate specific tasks currently performed by optometrists, allowing them to operate at their fullest capacity and potentially broadening their existing scope. Teleoptometry significantly improves access during the pandemic, and it holds the potential to improve access to eye care in remote areas of Canada, especially Indigenous communities where there might be a shortage of optometrists. However, establishing an appropriate regulatory framework, patient flow guidelines, and practice standards is paramount. The optometrist should remain in control, with technology being considered an assistive tool rather than independently operating. As technology evolves rapidly, safeguarding our patients and the integrity of our profession needs to be a priority, while also actively engaging in transformative innovations. The emerging field of oculomics, which involves identifying biomarkers in the eye for holistic patient health assessment, encompasses screening, diagnosis, and monitoring at the point of care, leveraging the combination of AI and fundus imaging to create groundbreaking diagnostic paradigm. This allows optometrists to identify potential health issues that may otherwise go unnoticed, emphasizing the importance of their role in the broader healthcare landscape. So eye health, vision care, and rehabilitation services must become a public health priority. We urge the federal government to lead the way and support raising awareness in public health, along with other healthcare professionals, about eye health, and specifically around the major eye diseases, cataracts, age-related macular degeneration, glaucoma, diabetic retinopathy, and dry eye. A January 2023 Abacus data poll demonstrated that 67% of Canadians supported an increased role of the federal government in eye care and vision care. Furthermore, 77% of Canadians supported the notion of a federal eye health strategy that would ensure that Health Canada could rapidly consider new applications for treatments and devices used to treat eye conditions, promote research and improve data collection on eye disease prevention and treatment, enhance vision care access for people who are underserved, including Indigenous populations and low-income households, and promote information and knowledge sharing between the federal and provincial governments in relation to eye disease and prevention. We hope to see swift passage of Bill C-284 very soon, and we believe it can bring significant positive changes to the eye health and vision care landscape in Canada. And I do want to thank those in the room who have already spoke to Bill C-284 in Ottawa, so thank you for your input, and hopefully we will be seeing this bill go through very soon. So thank you very much for allowing us to speak here today, or allowing me to speak here today. I really appreciate your attention. Thank you.
I'll just get started, maybe to get some reflections from the panel after hearing from your other speakers. Just sort of really briefly, was there anything sort of different or surprising that you took away from some of the conversation? So I'll just go down the panel, starting with you, Keith. What sort of intrigued you today, I guess?
Is this on? Okay, nothing particularly jumped out at me except the consistency of issues that all organizations are dealing with. We've all been affected by the pandemic to some extent. The funding of research is inadequate in all areas. Funding of devices needs to be consistent across the board by province. Funding of the assistive devices program needs to be consistent across the provinces. So I guess what the aha moment for me is that what we're looking for is national consistency of vision health issues, whether they be ophthalmology issues, device issues, or rehabilitation issues. We would like to see national standards so that people get the same care wherever you live in Canada.
Thank you. Ian, I'll turn to you.
Yeah, I think for me, the takeaway from today's event is really how many different aspects there are to overall eye health and the thriving, the future thriving of people who are dealing either with a treatable illness or with the effects of vision loss, and to see the sort of the medical side and the rehabilitation side, it really speaks to the whole continuum of eye care that's necessary right across the board, from initial research on treatments right through, patient examination and treatment to, the eventual outcomes, be they positive or not, into the rehabilitation space. And we've got everybody at the table here talking about all aspects of that journey. And I think that's seeing that kind of coalition and that collaboration and that everybody's kind of speaking in the same direction is really gratifying for me in terms of improving the outcomes for Canadians with eye health issues. Thanks.
Great. Thank you. Yes, it's very nice to hear that. I think a lot of our priorities are aligning, which is great. I think having that to help move things forward is really important. Learning about sort of the access or the lack of access to vision rehabilitation and assisted devices, I think was a big part that I learned today. So thank you for sharing that experience. And maybe there's some collaboration that we can do to hopefully help people who have experienced vision loss to access things that can help them, follow their dreams and to improve their sort of social economic well-being.
For me, I'm going to take a little different tack, and that is that I think a number of the things that we heard today outline how we are in Canada facing a situation where our regulatory environment does not evolve nearly fast enough to deal with developments in new devices and new treatments, be that if assisted devices, the iPhone not being covered, to new drugs that work in different ways that they're really not able to deal with existing regulations. So I think our regulatory environment needs to be evaluated and reevaluated much more regularly than it has been in order to help us move forward.
Okay, thank you all. So I'm going to open it up to the audience. Does anybody have any questions? You can put your hand up. I see somebody at the back. Mohammed's coming by with the microphone.
Is it for me? Oh, yes. Thank you. Is this clear? Am I clear? Several years ago, I was approved for funding for a new laptop with fusion technology. Although I was competent in the computer language, having worked in the field for many years, the loss of vision made that a bit difficult, and I wasn't sure I was going to be able to adjust to this new way of using a computer. Fusion technology was installed. And as part of the ADP funding, I had a trainer come out to my home once a week for 10 weeks. This was supposed to be for 10 hours, but it turned out to be 20 to 25. The training was very helpful. I did all my homework. As a result, I'm able to function quite adequately with my computer now and do most of the things I could do before I lost my sight. My question is, that effort to get from where I was to where I am today took a lot of time and effort on her part and on my part. How are you going to roll that out to the thousands and thousands of other people, some of them in rural areas, who need the same kind of support?
Thank you. I think that question is probably directed to Ian. So, talking about the amount of effort it takes to properly train somebody on some of these assistive devices, and how do you imagine it being able to be rolled out, especially maybe in rural areas?
This is an ongoing challenge for people who use assistive devices. As has been mentioned with respect to research and medical device development and new treatments, the landscape is constantly evolving. Every week, it seems, there are new devices, new programs, new applications coming out, all of which require training. Even the existing devices that are out there evolve through software updates, et cetera. So there's a constant learning curve. There are challenges with trying to provide adequate training for those devices. And in fact, one of the things that most assistive devices programs really worry about is someone will be funded for a device, they'll forget how to use it, or they will not learn appropriately how to use it, and it will just sit in a drawer and not be effective. So training is a huge piece of the puzzle, and it's one of those areas that really needs to be addressed within the rehabilitation chunk of what we're hoping Bill C-284 will address. With respect to training for people in remote areas, one of the things that the pandemic has taught us is that we can work remotely. So there's an enormous potential, not only in terms of the diagnostics that you heard about earlier, but also in terms of assistive device training sessions that could be held virtually. This is something that a lot of people have been talking about over the last couple of years, the idea that we can do things like assessments for assistive devices and the follow-up training that would come once a device has been received. We can do a lot of this remotely and do periodic check-ins remotely as well. So there's an opportunity here to reach rural and difficult to access communities and get them the devices and the training that they need. Thanks.
Thank you. A little follow-up, and then I'll get to Keith, because I think you want to comment as well. You mentioned that there is maybe fear that people won't use their devices as they were trained to. Is there any evidence or data that people are not using devices that they've been trained on?
I'm not sure I've seen any formal data. I have seen anecdotal evidence in talking with folks who use assistive devices that in some cases they've been given a device. And there are sort of two sides to it. One is they were assessed for a device that was the closest fit to what they needed, but because of the limitations within the assistive device program, it was the only device that was available and not necessarily the exact device that would have best suited their needs. So there's a fall off there. But in some cases, there are actually situations where either someone's eye condition has deteriorated, so the device is no longer relevant, or they've just not had sufficient sustained training to be able to grasp the basics of using the device. So there are instances where that does happen, yeah.
Thank you. Keith?
I just wanted to say that Balance for Blind Adults currently offers remote training. So for people in rural areas, you can get assistive devices training remotely. And I believe CNIB and VLRC do the same, but maybe people over there could reinforce that is the case. They're saying yes. Okay.
Thank you. Is there another question in the room? So there's a question at the front. So before you ask the question, I guess I'll ask maybe each of the speakers to maybe reflect a little bit more. We're talking a lot about the National Eye Care Strategy and the impact that it might have. looking forward with the hope that it is approved, what do you think some actions are that you would like to see happen in the short term, say 12, 18 months, to start to make some of the changes we're talking about a reality? And Dr. Hooper, I'll start with you on that end.
I think as part of the strategy, we need an infrastructure that develops the waypoints moving forward, that looks at many of the things that we've already brought up that are problematic, and develops a framework then, or a potential framework that they could be solved. So that I think the first step is categorizing what we've already heard in the room today, developing a framework to move forward, and then hopefully having an infrastructure that will coordinate the effort going forward.
I think one of the big pieces that we've talked about is that public awareness, the importance of comprehensive eye exams, the importance of eye health, and really educating the public that, I think we've heard that from a few of the speakers today, that people expect that their eyes will tell them when there's a problem. And, I've always reassured my patients that I want to see the problem before you see the problem. And so educating the public to increase awareness so that disease can be detected earlier and interventions can be started earlier to help prevent vision loss.
Thank you. And Ian?
I think from my perspective, there are a couple of things. One, I think in addition to funding the sort of medical side of research, there needs to be a lot more hard data on the experience of living with vision loss in Canada, so that the vital importance of rehabilitation services can actually be understood. I think there's a great gap in the understanding of the needs of people with vision loss and how incredibly important it is to have access, equitable access to the services and supports that are foundational to our integration into broader society. So the rehab piece of it for me is really, really important. And that starts with information. It starts with awareness.
I guess your question is, where do we go from here?
Exactly, yeah.
Okay. Just trying to understand it in simple terms. Yeah. Okay. I feel that the next stage has to be getting a group together and setting a national eye health strategy. And I think that there are particular needs that my colleagues here have talked about, but I think we've got to sit down and do this in a comprehensive way. Everything's got to be holistic. We want to make sure that vision rehab is at the table, that it's not just a vision health issue. Vision health starts, as Ian pointed out, from research through diagnosis all the way through to rehabilitation. And I'd like to see a group together that comes together to put a plan together that looks at everything in a holistic manner, and that we don't just stab at this and say, gee, we need to correct this or we need to correct that. We need to do it all, and we need to do it in a consistent manner.
Okay, thank you. I think there is an audience question.
Hi there. I think my microphone's on. Yep. Okay. My question is, earlier it was talked about the iPhone not being covered by ADP. If someone in a wheelchair if someone that can't walk needs a wheelchair, us that can't see, an iPhone would be our legs, our orientation, our mobility. So why is it that ADP doesn't figure this out? Am I asking too much?
Sorry. I shouldn't laugh. Why can't government figure out that vision rehabilitation is important? I don't know. Is the honest answer. I think that Part of the problem is government tends to operate, and I'm speculating here, but I think government often tends to operate on the if it ain't broke, don't fix it model. And what that means is they go through a very tortuous sort of process to get to a policy decision point, and then they implement that policy, and if nothing bad happens, then they just carry on executing that policy decision. I think what has happened over the years particularly with the ADP in Ontario, is that they set up a series of policy decisions back when the program was initiated back in the 70s and 80s. And the thinking underpinning those decisions has not evolved with the changes in society that have come over the last 4 decades. I was talking with Keith earlier about the fact that, what's happening in the assistive device space is a combination of technological integration or convergence, where you're seeing multiple devices being designed into a single device. You're seeing applications being brought onto mainstream devices that are not specifically designed for people with disabilities, but are being modified in ways that people with disabilities can make use of them. And jumping onto the back of that are the applications developers who are specifically designing for people with vision disabilities, but are building those tools to run on mainstream platforms. So you're seeing all of these kinds of integration, and systems that have been developed, like the internet, like mobile phones, like tablets, that were not part of the conversation back in the 1980s when these programs were set up. So the programs themselves have some foundational thinking that needs to be brought into line with current need and with current technologies and with current trends, so that the two can be married up. And I think that's what's missing from the equation. And I think people in positions of decision-making in government haven't made that connection yet. So that's the part of the conversation we're trying to have with them, to get them to realize that there's a gap there.
I guess they're still smelling smoke from ages back then.
Yeah, that's one way to look at it, yeah.
And I wanted to, I guess this is a big question for all the panelists, but maybe we could start with you, Ian, as a follow-up. Thinking about your respective areas, whether it's optometry, ophthalmology, vision rehabilitation, research, are there some jurisdictions, some countries, or organizations that are doing things well, and they are things that you think Canada should emulate?
I think looking across jurisdictions for best practices is always a good idea. There are certainly, other communities in other jurisdictions across the world that, are making advances further and faster than Canada is. I'm struggling to think of a specific example right now, but I know that, Australia, Germany, the European Union, the States are all pushing ahead with advances in rehabilitation, but I think it's one of the things that's critical to getting ahead of building a rehabilitation strategy is doing some kind of a broad survey of what best practice looks like around the world and where we would like to sit relative to that.
Keith, do you want to go?
I can't speak for specifics on specific issues, but one thing I can say is that there are several countries throughout the world who have national eye care strategies. And the leader in this regard, in my mind, is Australia, where they have, first of all, they've had a plan for many years. They've redone their plan. They have funding for devices that's quite generous. And there are examples around the world. There's smaller countries like Singapore that have a health strategy. We need to take those from other countries and learn from them and see what applies in Canada and carry on with it.
And Dr. Scott or Dr. Hooper?
Yeah, I think these are great points that are made. Certainly looking outside of Canada to see what's worked and what hasn't worked. I think there's a lot of learning opportunities there. Sort of discussing Indigenous health, I think there's ways that we can learn from other countries there. And even interprovincially, if some provinces are able to provide more assistance with assistive devices, whereas some provinces don't have access at all, I think trying to solve some of those issues even within our provinces is important, and hopefully that's something that Bill C-284 can help us address.
I would agree that from my perspective, I think Australia is the best example of a similarly sized country that has a more integrated approach. I think in Canada, one of the other things that we need to look at, as was just mentioned, is the discrepancies between provinces and the fact that the provinces all operate very independently with respect to health and the delivery of health care. And we have a situation, particularly in a regulatory environment, where everything has to be approved 12 times before we have any kind of national strategy, and that really needs to be looked at.
I know the conversation came up a little bit at the Senate hearing. I'm not sure if it was with when the Honourable Judy Sgro was talking about have we already engaged with the provinces, because ultimately the provinces are the ones who deliver the health care. So it is, if anybody has anything to add about the provincial setup and how we could best maybe take any findings from the federal level to the provincial level, happy to have that discussion, but I know it's also a really complicated discussion. I've got a question from the audience online. So I think this is probably a little bit more directed for Ian, but if anybody else wants to input, please do. So the question is, how sure are you that remotely controlled assistive devices cannot be hacked? Is there quality assurance and cybersecurity for those who had eye barcode implants that it won't be used for identity theft?
Wow, that's a really good question. I'm not sure I can address that directly. I know that cybersecurity is a systemic issue. Whether it gets down to this, the sort of the individual level with respect to assistive devices, that's a really hard one. I think there's a lot being done to address cybersecurity with respect to smartphones. That having been said, there have been hacking incidents. So I'm not really sure how to address that question, to be perfectly honest.
Okay, that's fair. Are there any other questions in the audience? Okay, we've got one right up here. Jim Tokus.
Hi, I'd just like to make more of a comment than a question. I think that, many times when we try and educate the public, as a patient group, which we're all trying to do all the time, we're told now to get into more of a simple language process when we're explaining things. So, a perfect example, 2 years ago, before, and I'm going to mention a name here because it's important, Specsavers came out with an ad about OTC. How many people knew what an OTC was 2 years ago? So this is just an observation. Very simple, funny, makes you want to watch and see, but sticks in your brain. Now everybody knows what eye screening is. So congratulations for coming up with innovative ideas that are simple and the public understands. This is what we all have to look for. And I know that's not the answer to all of our problems, but I just wanted to shout out to Specsavers. What a great ad and what a great educational tool. And that's how simple it is. A lot of it. Thank you.
Any other questions from the audience or from online? While that happens, I've got a question. I think maybe starting with Dr. Scott, but probably also Dr. Hooper. You mentioned the idea of a comprehensive eye exam. And I was wondering if, maybe first from an education point of view, the difference between comprehensive eye exam versus maybe what you would consider just an eye exam or screening, and the importance that you put on using that terminology, comprehensive eye exam.
Great question. Thank you. A comprehensive eye exam is looking at both, how vision, how well you see, how your eyes move together, so your binocular vision, how the muscles move around, how you sort of perceive the world, your refraction, your prescription for glasses or contact lenses, but also looking at the overall health of the eye. So one of the concerns is that sometimes if we remove just checking for glasses out of an eye exam, then you're not detecting for the diseases like glaucoma, diabetic retinopathy, macular degeneration, and as we've sort of focused a lot on today, the importance of detecting these diseases before it starts impacting your sight. So you can have early stage of a lot of those diseases and still see 20/20. So it's the importance of including a detailed health check in an eye exam, which is what's really important to detect these diseases and help prevent vision loss.
Great. Keith, do you want to?
I have a question.
Okay, great, perfect.
I'd like to ask Dr. Scott, has there ever been an attempt made to get family practitioners involved in referring their patients for eye exams?
I believe so. In my practice, I certainly do see family doctors refer patients over for comprehensive eye exams. Sometimes we'll see referrals for, foreign bodies and red eyes as well. We would like to engage that conversation more, and I think it's a very important conversation to have. But I do believe that those channels are open. And again, depending on province to province and coverage that may be accessible, some provinces have easier access to having publicly funded exams. And I think that's one of those other pieces that we might look at with where we're looking at sort of difference in provinces is those changes as well.
And Dr. Hooper or Ian, do you have anything that you want to add to this part of the conversation?
Yeah, I mean, one of the things that Keith and I were talking about over lunch was just the idea, the question, I guess, of whether if people typically go in for a regular physical, if they do that, I don't know what proportion of the population does, but if they do that and your GP had access to the last time you were seen by an optometrist or an ophthalmologist, they might be able to proactively say, hey, it's been a couple of years since you've had an eye check. Maybe you should go in for a full and comprehensive eye exam. It just seemed like if those two aspects of the medical were connected through information sharing, it would be a relatively easy thing for your GP, who probably has greater access to you than your ophthalmologist, could make that referral. That was the thinking behind it.
I would agree that that's the link, the communication between the optometrist and the family physician in terms of what actually is happening. I think it really comes down to two populations. If you look at what are the key diseases that you want to diagnose early because early intervention has been proven to prevent progression or at least slow it down, it's diabetic retinopathy and glaucoma. Glaucoma, by and large, involves a population over the age of 60, 65. The good thing is that in virtually every province, that group is funded for a regular eye examination, typically yearly. And so if there is a communication between the family physician as they're seeing these people, which typically they do at least once a year in that age group, and the optometrist, that could move forward. I think the diabetic group, though, is a little more problematic because there, as I understand it, in some provinces, screening for diabetic retinopathy isn't covered. But if you have diabetes and you actually have retinopathy, then the follow-up is covered. And so Again, it's a matter of changing the regulation and improving the communication to get that population. And I view that, given our statistic of 25% of diabetics not recognizing that they can have eye disease, that's a big population we have to target.
Does that mean that endocrinologists are not telling their patients that there's a possibility they could have retinopathy?
I think they are, but a lot of things happen in a juvenile diabetic. When they're told they are diabetic, their life as they know it suddenly changes. They have a whole lot of restrictions. They have a big change in lifestyle, and I think that becomes overwhelming. I think they were probably told initially, but they're not told as they're going forward, and there isn't a direct way of saying, okay, you must have an eye examination, and checking back in, you did have an eye examination, and this is what it showed. Because in the diabetics that I deal with, and I deal with lots of them, they know there's a potential, but they always assume it's going to be when they're much older and if their disease is not well controlled, and those are misconceptions, and they're wrong.
And I would say, for myself and my practice, we do try to let the family doctor know that I send a report for every person who has diabetes that I see in my clinic. I send a report back to their family doctor. I think a lot of times the family doctor is very good at making sure that that's been done, and they appreciate getting those reports because they can look back. And, I think you're right as far as I was very surprised when I saw that it was 21% of people were aware that, diabetic retinopathy could be visually threatening, because we do spend a lot of time talking about that to our patients. And so I think there's still more that we can do. And the communication as far as even for people who are, again, just coming in for routine care, and that, that's part of your yearly checklist of these are the things that, I need to do this year for my overall health, I think is really important as well, and trying to have that on the radar that's part of our overall health care.
Thank you. I think, we got another question from the audience.
Hi there. Since there's doctors on the panel, let me put something by you. Would it make sense for a family physician to have basic knowledge of taking your eye pressure or whatever in their office? Maybe that will give a beginning of something that could be going wrong with your eyesight, and an easy way to do it, and have a follow-up with the specialist?
I think that's a good question. I think it gets back to what my colleague was saying about the importance of a comprehensive examination. That's one aspect of care, and one pressure taken one time doesn't really have a very good ability to diagnose glaucoma. It's a group of things together. Technology is getting there. There are contact lenses now that can take your pressure real time as you're walking around. So the ability to monitor pressure in people at risk, I think, is changing. I think having family doctors much more aware and enforcing with their patients that they need to have comprehensive examinations is very important. I'm not sure they have the tools and the skills to really help, and may actually be a bit of a hindrance in that respect.
I agree. I think, it's always the balance when we talk about screenings. If we're doing screenings, again, diabetes is one that comes up frequently, that I guess the concern is that there may be a misconception that was a comprehensive eye exam. And so if you're screened for diabetes and you don't have diabetic retinopathy, which is great, but you didn't have your pressure checked, so you weren't screened for other eye diseases, that sometimes I think the concern is that there might be, I don't want to say false sense of security, but we want to make sure that everything is considered and looked at. So the pressure check, we'd also want to look at the optic nerve and the other risk factors before even maybe the pressure increases. And so trying to find the balance between screening and, but then making sure that everything is looked at appropriately is a fine balance, but I think that's a great question.
I think we have a time for one more question, and we've got, I think, a great question to end off from Jillian from online, who is asking, how can we better advocate for better access both provincially and federally? So this might be a good way to end the session. So I'll start with you, Keith. What, I guess, actions would you want the people listening to take today? How do you think we should be better advocating for access, whether that's to treatment or diagnosis or research or the National Eye Care Strategy?
Persistence.
You can have a few more words.
When you get to my age, you'll end up looking back at what's been happening. And I was recalling this morning that in 2004, I think, was the first time the National Coalition for Vision Health, which was a group of stakeholders which no longer exists. The stakeholders still exist and they still collaborate. But in 2004, we first started talking about a national vision health strategy. And here we are 20 years later, and it's going to happen. So you have to be patient, you have to be persistent, and I think you've got to take every opportunity to say something, to jump on the bandwagon, to do what Ian White does on assistive devices, to be there when the ADP program is meeting and keep getting under their skin to make sure that things happen. Advocacy is persistence and repetition.
Fantastic. Ian?
I'm going to repeat persistence. Yeah, I think Keith is absolutely right. It takes concerted effort over time. You know, at the end of the day, people with vision loss are somewhere between 3 and 5% of the Canadian population. What that means is that 95% of the population is not like me. And I need to understand that, you know, vision issues, while they can hit anybody at any time, and they do, many people out there never give vision a second thought. It's taken for granted. And they don't think about it because it doesn't get in their way. So I think public awareness, persistent messaging around the need for a comprehensive eye health strategy is vital. And we need to put the pieces in place. And I think, you know, one of the things that today has shown is that there are all kinds of stakeholders who are deeply invested in this process to make life better for Canadians who are dealing with eye health issues or eye health outcomes. So be persistent. Talk to your politicians, talk to your city councillors, talk to your provincial MPs. Make sure that they understand that eye health and eye rehabilitation is a critical concern, and just keep at it.
You know, having an opportunity to be here today, I find it interesting. I think all of our panelists sort of have a different perspective when it comes to sort of the role of Bill C-284, but a lot of our goals are the same, which I think is really great. You know, having these conversations in a forum like this, and you're right, speak to your MPs, speak to your MLAs, you know, speak to your friends and your family about the importance of eye health and vision, and how, you know, that can impact someone's overall health and overall well-being. I think these are important messages to just keep sharing with anyone who is willing to listen.
Thank you.
I can't agree more than with what everybody has said. I think the other thing is, because it is a very depressing road in some respects with how long it takes to enact change, I think the other advice I would give is talk to each other, because it can get very discouraging to talk and talk and talk and feel like you're never getting heard. And the ability to talk to other people who are going down the same road and have the same goals in mind can help get you resolved to keep going when it seems like nothing's happening.
Okay. I think that was all great last words. And Keith, over to you for the last word, I think.
Okay. Before I leave the podium, I'd like to take this opportunity to recognize Michael Bausch+Lomb. None of this would have happened without Michael. Michael was behind driving the initiation of the initial report card and this report card. Mike was behind organizing this conference. Mike was behind the creation of the wonderful White Cane magazine that's in front of you, everything from getting people to write articles to the layout and all the details behind it. This would not have happened, and I'd like you to give a big round of applause to Michael Bausch+Lomb.
Thank you, Keith, and I'll thank all the panelists and turn it over to the one and only Michael.
Thanks, Keith, but it's a team. Everybody here, whether it's Tanya Armadale, stand up, Tanya. Tanya edits the magazine, and she edits the report card, and I can show you all kinds of slashes on my wrist where she told me it had to be a comma and not a colon. So it's Tanya, it's James Bish, who's in Cambridge, who does the design and the layout. But it's also people like Kim from COS that'll pick up the phone and call me. Yeah, it's no big thing, Mike, but you might want to check that word out. It's wrong, or keeps you on your toes. And working with Larissa and Morgan is fantastic. But I also want you to point out that a true gem in this room, two of them are sitting side by side right now. Ian White is amazing in regards to his understanding and working with the government regulations and feelings, and being able to represent the vision loss community and the lived experience. Keith Gordon, whatever I'll ask for or whatever I need, or when we're working, putting things together or sending letters, or working with Larissa at FBC to support funding for a drug or getting it passed or taking a look. It's a team effort, okay? And a team effort has to have the support. So in the sense that I've got support from Jim Prowse and Mr. Tokas, and everything comes down. But I think one thing that was touched on here earlier was the fact that we've had the vision stakeholders have had 3 meetings regarding Bill 284 and going forward, and doing a lot of what you were suggesting or talking about today, where making sure that our voices are there, because our voices are representative of different fractions, but we're all working together. You can look at it, FBC and the CCB and the patient group and research, and I think Keith was right when he said it's not only the medical research needs to be done, or I guess it was Ian, we need to understand what it's like to be blind and who the blind community is and who these representatives are. We don't have a good understanding of it, and until to solve a problem, we need to understand what the problem is. So, and we're working with that. And then there's CNIB and vision loss rehab, and then there's the COS and the CAO, who are from the medical side. So we're all trying to work together to make sure that what goes into Bill 284 is in the best interests of the not only vision loss community, but the vision health community. So I thought an amazing job with the panel. We should give them a big round of applause. As for Keith Gordon, I'm starting a GoFundMe thing for all the nice things he said about me to see if I can liquidate it. Thanking our sponsors. We couldn't be here without them. They support the FBC and the CCB in the conferences, and they did an amazing job, and it's great. But they also, you have to appreciate, they also go the extra mile, because these people understood how important it was to get the second report card out. Okay? So those people understood it, and they were prepared and stepped forward and gave unrestricted grants so that we could do the report card. And that's important. And that's why it's 284. It's got to have money in it, because, you know, you can only go to the well too often. But the people up here that you see all helped bring this report card to fruition. And then everybody here that attended today and the people that attended online, thank you very, very much. And I guess I'll put the glasses back on. Doctor, it's my geographic atrophy that was misdiagnosed for about 5 years, and finally somebody told me what it was. That's pretty much a wrap. I hope everyone has found today's conference informative. Thank you for joining us today. This concludes the 2024 Vision Health event agenda for the Canadian Council of the Blind. We look forward to seeing everyone in 2025, in May during White Cane Week, in February during White Cane Week, in May during Vision Month, and back again in October during World Sight Day. The Canadian Council of the Blind will present a new round of conference and events. Good afternoon, and thanks very much for attending.